5 on your mental health now. Could a dedicated high school health class help reduce teen substance use? A new study involving nearly 2 million student responses found lower rates of vaping, marijuana use, and drinking at schools that offered these courses. Dr. Erica Lee, psychologist from Boston Children's Hospital, is here with us to discuss what may be working. Good to have you. Good to see you, Dr. Lee.
Hey, Dr. Lee. Happy Monday. So why might a dedicated health classes influence a teenager's decision, for example, about alcohol or drugs?
Yeah, the study is really interesting because, as you said, it surveyed a lot of students. So it surveyed all the 9th and 11th graders in California public schools who participated in dedicated health classes over a few years. And what the researchers think is that teens having access to health class on a regular basis was one of the driving factors. So not so much how they deliver substance use education, more that having a consistent emphasis on healthy living can positively influence teens' behavior. So this research is really interesting because it suggests that having health classes is helpful and maybe a really practical way to help reduce adolescent substance use.
It is easy to say, don't do it, don't use drugs, don't abuse alcohol. But what else can be beneficial in terms of education?
Yeah, so school-based programs are actually the most studied type of substance abuse prevention, and many of them have focused on something called life skills training, which looks much more broadly at different skill sets that can be beneficial to our adolescents and our pre-adolescents. So teaching students about things like your decision-making, your stress management, how do you communicate, how would you say no in a situation where you were offered substances, and what are the consequences of using them. And researchers actually found that that approach is especially effective for middle schoolers in terms of reducing later substance use, and for high schoolers it seems to improve their emotion regulation and their resistance to marketing. So it is likely about much more than just the actual talking about prevention and saying no. It's important to strengthen many of those associated skill sets.
But Dr. Lee, a lot of that starts at home, right? So what conversations should parents have at home?
Yeah, it's really helpful for parents to actually directly talk about these things. So not just substance use, peer pressure, self-esteem, all of these things are related. We know that teens are more likely to take risks, right? But having those open discussions with their parents, I guess as much as they're going to put up with us anyway, does actually seem important. And what the research shows is that there are a few things that parents can do, like staying actively involved with your kids, keeping track of what they're doing when they're not with you, letting them know that you're not okay with them using substances, having a strong supportive relationship, and as I mentioned, maintaining those open lines of communication that go both ways. These are actually all effective ways to reduce the chances that your teenagers are going to use substances.
Great, Dr. Lee. Thank you.